Joining us live this morning is Dr. Alon Vaisman, Infectious Diseases Physician at the University Health Network. Of course, having our COVID conversation here on a Tuesday morning. Dr. Vaisman, good to see you. Appreciate you joining us. So let's start here. Yesterday, the federal government announced that as of Saturday, all COVID-19 travel restrictions are going to be removed. So now that so many mandates and protection or prevention layers are gone, is there any modeling showing what we can expect for COVID-19 this fall? And are we potentially leaving ourselves vulnerable now to potential foreign variants?
So we don't have any thorough modeling out like we did in the past from Science Table, for example, or other major peer-reviewed publications that help us understand what's going to happen. But we do have information from jurisdictions such as Europe with regards to COVID, and we also have information for other jurisdictions such as Australia with regards to influenza, which mandate are both going to be issues, they're both going to contribute to having a wave this coming fall. But the other important observation to make is that the last two waves that we've experienced here in Ontario with very few restrictions to begin with, and they came and went, and the mortality rate has dropped to those waves. And the other observation is that the restrictions that were regarding border and people traveling in Canada and on planes are not likely going to have a major effect on the overall picture. And the reason is that the vast majority of COVID transmission that occurs in Ontario does not occur in those cities and does not contribute to having large waves. It still occurs in
Dr. Vaisman, you know what? We're going to take a bit of a break here because we're getting a bit of a sort of double skip audio. It sounds like you're kind of like getting remixed as you answer the question. So we're going to reset, take a quick break, and come back so our viewers can get a better understanding of exactly what you're saying, because these are important questions. So we'll take a quick break here on Breakfast and come back with Dr. Vaisman. We'll get this fixed up for you right away. All right, so welcome back now. Dr. Alon Vaisman rejoining us here, an infectious disease physician from the University Health Network. We've got the sort of communication hiccup fixed. So Dr. Vaisman, let's get back into that first question, because, you know, this is such a significant change here. Coming up, of course, on Saturday, all of the COVID travel restrictions across Canada are going to be removed, no masking, et cetera, on planes and trains. So now that so many of these, you know, mandates and kind of levels of protection and prevention layers have gone, do we have modeling showing what we can perhaps expect for COVID-19 this fall? And are you concerned that we may be leaving ourselves vulnerable to potential foreign variants now that we're not monitoring at airports and trains, et cetera?
Right. So at this point, we don't have any modeling coming out of what we used to have, which was the most common one, this Ontario Science Table. And also, we don't have peer-reviewed publications to help us out to figure out what's going to happen this coming fall. But what we do have is information from the other jurisdictions, such as those in Europe, regarding COVID, noticing that they do have waves still, just as we expect, and also regarding influenza, which we also expect to cause a wave this coming winter from Australia, for example. But the important thing to remember is that these restrictions that were lifted at the border and regarding travel are not likely to have a major contribution to the overall number of cases we have, and that's the reason they were lifted. And the reason is that the vast majority of transmission does not occur in those settings. It still occurs in intimate settings such as people's homes or workplaces, and not in travel. Those kinds of cases are not going to be the make or break when it comes to the wave this coming fall. The other aspect to that restrictions that were lifted was the vaccine mandate, which at this point is much less effective than it had been in the past, due to the fact that Omicron is much better at evading the immune system, and also the waning effect that Omicron has on the vaccine over the course of approximately 3 to 6 months. So the vaccine still remains important to protect people from having severe outcomes, but it doesn't make as much sense to be used as a mandate when it comes to the borders.
Okay, I'm really glad we got that answer with all the clarity that we could get there, Dr. Vaisman. Let's move on then. And you know, you just talked about vaccines there and Omicron, et cetera. Can you help us understand the bivalent COVID-19 vaccine timetable? The government's timetable is anywhere from 3 to 6 months after your last dose or infection. That seems like a large window. What's your recommendation, or what do you understand should be done when it comes to this?
Right, so that recommendation of 3 to 6 months is based on a rough estimation on when we think the immunity you gain from a boost starts to wane. We know that at 3 months it definitely drops, and at 6 months it's quite low. So our individuals who have recently had infection or had recently boosted should be given a vaccine at that interval. It's hard to know what the best timing is, but I would say that given that we anticipate there to be another wave, a rise in COVID cases again, just like we do every wintertime, approximately in December, January, February, the most sensible thing to do is to try to aim for a booster to be given just before that time. So for example, sometime in November, early December, or even late October. Unfortunately, we don't have a specific right answer here because the data in this specific setting is lacking, even furthermore for this specific bivalent vaccine. So that's why NACI and the government, the federal government, the provincial government are giving people this leeway. If there was a specific right answer, from the evidence, then those would be provided to us. But I think the main message is to get a boost sometime very soon before the winter wave begins.
Speaking of waves, it's interesting in the government press release yesterday when they announced that they were removing all those sort of travel mandates, et cetera. They talked about how BA4 and BA5 waves are sort of finished and over. I wonder, in your own experience, Dr. Vaisman, what are you seeing COVID-related now, patient load, that sort of, what's the level of, COVID that you're actually seeing and experiencing on the front lines?
So two important observations that we noticed over the last few months. The waves that we started off with in the winter and spring, they never really completely went away in terms of going back down to baseline or to very small cases like we did in the previous years. So we're still seeing a low level number of cases in the hospitals, still, even now. The second important observation is that despite there being large numbers, the number of patients who have COVID pneumonia, which is the complication that leads to patients needing to be hospitalized, going to the ICU, and in some cases dying, those number of patients has dramatically fallen. So although we're still seeing patients with COVID in the hospital, more and more often it is more incidental or contributing to a precipitation of a chronic illness rather than the direct cause of them having to be hospitalized for pneumonia. And that's very, very important because that's what defines this Omicron, the last few Omicron waves from all the other waves we had in the past, is that the proportion of patients getting complications is far, far lower.
Okay, that's really interesting to hear that sort of information there, Doctor. In the meantime, I want to sort of switch gears. Chanel's on the story today about this finding out of this study from Toronto Unity Health. About 170,000 Ontarians lost their family doctor in the first 6 months of the pandemic. I realize you're not a family doctor, but how concerning is it to you when it comes to people's overall health, when people really don't have that primary point person who really understands their general health or knows, when the last time they were checked or assessed for certain health conditions? 170,000 people, it sounds like a big number.
Yes, absolutely. And in terms of the general aspects of patients' health, cardiovascular health, mental health, all of those things are, of course, first addressed by a family physician. The physicians who know the patients best and know the patient's families best, know their social situation best. So that is certainly a major concern. But for the area that I'm most familiar with, infectious disease, one example you can think of that is really critical and will be lacking in this area is even COVID management. For example, prescription of Paxlovid or prescription of other antibiotics or things that would keep patients out of hospital. If we don't have family physicians who know their patients well, seeing their patients, if there's a big gap in that care, that will unfortunately result in some patients requiring hospitalization or visits to walk-in clinics or EDs unnecessarily. So if you're able to see a family physician, somebody who can look after you earlier on in your infection, for example, also STI screening, sexually transmitted infection screening, that's another important aspect. If you're not able to see somebody who can help you with those things early on, unfortunately, those things can become more and more complicated and require more and more care.
Yeah, that's interesting, right? Because, of course, if you have that relationship with that sort of, family physician or doctor that you've known for years and years, they can kind of nudge you in a certain way when it comes to, like you mentioned, vaccinations or other sort of testing indeed. So that's an interesting observation on that study. Dr. Vaisman, always appreciate the time. Thanks so much for joining us here on this Tuesday morning, and appreciate you getting through that sort of technical glitch we were having, but good to have a conversation, and I'm sure we'll talk to you soon. Thanks so much.
Thank you.